Hi, I'm Lynn Stevenson, and I'd like to welcome you to the virtual recruitment for our Advanced Heart Disease Transplant Fellowship at Vanderbilt University. I really wish that you could see and hear the birds that are sing every morning here and see the incredible trees that are above, but you can't. However, I'm hoping we can still convince you this is a wonderful place to make your home and to do your training. I am the director of the Advanced Heart Disease and Transplant Fellowship here at Vanderbilt, and I'm going to tell you just a little bit about myself. I went to Princeton and then to Stanford. I did my cardiology at UCLA, and I stayed in the faculty there for about 10 years. Then, together with my husband, I moved to Brigham and Women's Hospital in Boston, where I spent the next 24 years with my husband, who is Bill Stevenson, known as the VT guy. While I was there, I trained many fellows, many of whom have gone on to establish programs of their own. They are my greatest pride and my lifelong friends. We moved to Vanderbilt about 3 years ago, my husband, my daughter, and I, because we were captivated by the energy here and the diversity of scientific opportunity and the chance to work with new colleagues. Since I've been here, I'm expanding my interests into genetic cardiomyopathy, into learning about the physiology of heart failure at home with our ambulatory monitoring, and into personalizing patient care according to their priorities for what's really important to them.
Hello, I'm Kelly Schlendorf. I'm the director of the section of heart failure and transplantation and also medical director of the adult heart transplant program at Vanderbilt University Medical Center. And on behalf of me and my colleagues within the section, welcome to Vanderbilt. Thank you for your interest in our Advanced Heart Failure Fellowship, and we really look forward to meeting each of you on interview day. As you think about your opportunities for fellowship training next year, there are a few things I want you to keep in mind about our program. The first is that ours is a section that's really full of talented, hardworking, really fun individuals who are very much committed to training the leaders of tomorrow. And as you probably know, there are several folks within our section who are really leaders in the field and have been doing this for decades, and there are others who are a little bit closer to their own training experiences. But all of us are very much committed and eager to teach, and this is one of the things that we consider our top priorities each year. And the really cool thing about our section is that we get to do this alongside really amazing surgical colleagues, nursing and nurse practitioner colleagues, and colleagues from many other disciplines who our fellows work closely with. That includes transplant infectious disease, the cardiac anesthesiologists in our ICU, and many others. Second, keep in mind as you think about your training experience that you really have 1 year to learn everything there is to know about heart failure and transplantation before you go out there and do it yourself. I'm a big believer in the fact that learning is a lifelong process, but again, you have one final training year to learn all there is to know, and so in that sense, clinical volume and the breadth of what you're going to see is really important to take into account. I think the experience that fellows have here at Vanderbilt is really unparalleled, except at a small handful of other centers across the United States. You are going to see and experience and take care of just about every heart failure pathology there is, as well as every complication that occurs after a VAD or a transplant. And again, that's a pretty cool experience to have as a fellow. And then finally, as you think about interview day, just keep in mind that it's an opportunity for us to interview you, but also for you to interview us. And so I encourage you to ask questions and to think about not just what life in the hospital will be like if you choose to train here at Vanderbilt, but also what life outside the hospital will be like. Nashville's a really cool city. It's a fun place to live and a fun place to train. So again, thanks for your interest in our program, and we very much look forward to meeting you on interview day. Bye-bye.
Hi everyone, my name is Lynn Panus and I'm the Associate Program Director for the Heart Failure Fellowship at Vanderbilt. I'm so excited that you're considering our program, and I believe we have many strengths to draw your interest, including our clinical training, which exposes you to large volumes of patients in the arenas of heart failure, transplant, and VAD, our research opportunities with mentors and colleagues that are invested in your success, and our curriculum, which incorporates clinical conferences as well as lecture series in journal clubs, quality improvement, and primers on topics such as donor call, immunology, and ECMO. I moved to Nashville from Philly a couple years ago, and every day I continue to learn from our amazing team of faculty, fellows, and advanced practitioners. I'm sure you will too. I look forward to meeting you.
Welcome. My name is Sandeep Zalawa. I am the medical director for the VAD program at Vanderbilt University Medical Center, and I'm really excited to introduce this program to you. Let me tell you, I was actually a fellow in this program many years ago, and I enjoyed this program so much to the point that I stayed and I haven't regretted a day since I joined this program. And let me tell you what keeps me going every day here. Having support of world-class faculty members, portfolio of temporary and permanent devices, including total artificial heart, one of the world's highest transplant volume, amazing patients, amazing pathology that you will enjoy and learn so much. I sincerely hope that you consider our program. We will make this a successful adventure for you, and we are really excited to make friendships of lifetime with you all.
Hi, I'm Joanne Lindenfeld, and I want to welcome you today to Vanderbilt and our heart failure and transplantation program. We are participating in multi-center NIH grants. We are very interested in participating in grants that explore diversity in the allocation of advanced heart failure therapies and studies in transplant, mechanical circulatory support, and heart failure. We have a very active investigator-initiated research program, and we are the coordinating center for an investigator-initiated study of SGLT2 inhibitors in acute heart failure.
Hi, I'm Jonathan Monokum. I'm one of the transplant cardiologists here at Vanderbilt. My area of interest is developing niche of failing congenital heart patients that need advanced therapies such as transplant or mechanical support. So I spend the majority of my research time, at least, focused on how we get these patients to advanced therapies and how we get to them sooner so that they have better outcomes.
Before this, I finished my critical care fellowship at Baylor, Houston, and I trained in cardiology at the University of Kansas. And I'm here to tell you a little bit about what the day in the life of a CCU fellow looks like. So as a fellow in the CCU at Vanderbilt University, you're responsible for taking care of the patients, heart failure patients that are admitted to the CCU primary team, and you also serve as a consultant for the heart failure patients that are admitted on the cardiothoracic surgery. So first things in the morning when we get in, we pre-round on the patients that we'll be consulting and we'll be primary on. And then at 8 o'clock, we have multidisciplinary rounds where we have our surgical attending, surgical teams, the anesthesia critical care team, and our teams, and we round on patients that are on mechanical circulatory support, be it new VADs, be it new heart transplants, patients that are on ECMO, where we work as a team in figuring out how best to take care of them. And once we have finished our multidisciplinary rounds and rounded on those patients that are shared between us and the surgical teams, then we move on to the patients that are on our primary and need the ICU level care for those conditions.
Hey everybody, I'm Alvin Rowland. I did my general cardiology training here, and so I was very fortunate enough to join the team. Currently we are at the Vanderbilt Cath Lab. This is where a lot of amazing things happen with an amazing staff. During our times in the Cath Lab, we get to work with a lot of awesome attendings, some of which include Dr. Monokum, Dr. Brinkley, Dr. Zalawa, in addition to other interventional colleagues that we do share the lab space with. While in the Cath Lab, we do a variety of different tests, including right heart caths, endomyocardial biopsies. We do provocative maneuvers as well, really to help gauge certain responsive therapies that we'd like to try for some of our patients. In a typical day, I'd say we probably average about 7 to 8 sometimes right heart caths, and that's sort of oftentimes split between a half day. So as you can imagine, particularly busy days, it can even go even higher. So.
Hi everyone, my name is Richa Gupta. I did cardiology fellowship here at Vanderbilt. This is our ambulatory clinic. So on our ambulatory clinic blocks, we spend a lot of time in transplant clinic and in VAD clinic. We do at least 3 transplant clinics in a week and at least 2 VAD clinics in a week. And they tend to be pretty busy, filled with patients. We also do elective clinics, and those include pulmonary hypertension clinic, adult congenital heart disease clinic, inherited cardiomyopathy clinic, and hypertrophic cardiomyopathy clinic, just to name a few.
So for me personally, I chose to be at Vanderbilt for my heart failure training because it's one of the largest transplant programs in the country, and I had heard phenomenal things about the mentorship and the career opportunities that are available to fellows up here through folks that have come through before that. And this is also my alma mater, and I did my undergraduate training, so I wanted to be back here because, as they say, it's good to be gold.
Why I chose Vanderbilt. For advanced heart failure, to me, it's a no-brainer. First off, the staff here is amazing. The expertise within this field is bar none. Constantly pushing the envelope in terms of what can be done. We are actually one of the busiest transplant centers in the country, and that's not even to include the number of mechanical support devices such as left ventricular assist devices. And so just from a volume standpoint, it also affords the opportunity to deal with a diverse population of patients and disease states. One of the big strengths here is sort of the collegiality between a variety of different departments, particularly the electrophysiology department, as well as the interventional cardiology department, and our imaging.
I chose to stay here for Advanced Heart Failure Fellowship for a couple of reasons. It's actually a long list of reasons. One, I think the number one reason is the people here. I have access to incredible mentors. It's a really big heart failure department. There's a lot of research going on. One of my interests is actually in imaging, which I've sort of been able to incorporate as well. Also, you're never going to find sort of the kind of volume that we have at any other place in terms of both transplant and VAD. It's a great place to just learn how to do that from all of our patients.
The biggest strength of the program is the exposure to complex advanced heart failure patients. During my training year, the center performed more than 100 cardiac transplants, which is a very impressive number. And by the end of my training, I was very comfortable in managing patients with cardiac transplant or VAD. The next plus point is the opportunity to work and learn from some of the leaders in the field of heart failure. There is a great learning environment with the emphasis for you to grow as a physician. In my last week of fellowship, I took a moment to reflect on how much I knew when I first started my fellowship, and over the course of 1 year, how much I've learned. It is a very satisfying feeling, and I cannot thank the program for everything they've taught me and have done for me over in that year. Thank you.
Hi, my name is Jess Houston. I came to Vanderbilt initially for general fellowship in 2016 and stayed on for my transplant year. So I've been there for about 4 years. I do feel like I've been prepared very well over the last 4 years, and especially the last year, given that I've seen a large volume of transplants and volume and breadth of disease. One of the primary things that initially drew me to Vanderbilt was the number of women I saw in leadership positions. And I think that permeates into the Advanced Heart Failure Fellowship as well. I think the training is unmatched, and you will get exposed to anything and everything you can think of, probably multiple times. And for example, my last week on service, I got a master class in acute rejection and used more thymo and ATGAM than I had used all year. So you really are going to see the things that are the scariest, and you have to be on top of and have firsthand experience treating those patients, which I thought was really important.
My heart failure fellowship helped me tremendously, not only clinically making me strong in hemodynamics, but also academically. During my fellowship year, Carlos, my co-fellow, and I had more than 15 abstracts presented in ACC, HFSA, and ISHLT. We did oral presentations in the ISHLT meeting in France, and we were able to publish our work in JACC and Journal of Cardiac Failure. I still continue to work with the Vanderbilt team, both in prospective and retrospective studies. It is impossible to count the program's strength in one short video. The program is absolutely fantastic, has such an amazing faculty. Going to the Heart Failure Conference every Monday or the selection meetings on Tuesday was like being on a society meeting. It was just an amazing discussion every day. And it's not only the faculty was great, the staff was extraordinary. Nurse practitioners, the transplant coordinators, the VAD coordinators, the ICU staff, it was just incredible. And aside from the people, it would have taken me at least 4 years in any other program to see the amount of transplants and get the transplant expertise that I got in my year of heart failure fellow. I think during my year there I saw it all. We had very difficult cases, and actually we saw many transplant zebras. Matter of fact, when I left Vanderbilt, they gave me this present and carried with me my transplant zebra. We really saw very, very sick patients, and I really learned a lot. I hope you'll enjoy this video, and good luck to everybody.
So tell me a little about a typical week.
Monday morning, roll in, make a cup of coffee on the Keurig.
Exchange some sarcastic humor with these two. Okay, get to work. And then disperse to the individual rotations.
Yeah.
Whether it's a CCU or it's a heart failure or the VA or the VAD transplant floor. We'll come back at around noon, do our Monday noon lecture.
What's the main event on Tuesday afternoon?
Selection committee. So after lunch on Tuesdays, all orbits or all planets orbit around selection committee. So formally 4 and 3 in post-COVID, everyone meets and goes over all the new patients that are potentially eligible for VAD or transplant. And the hours before, everyone's combing through investigations, figuring out what's missing, what's pending, what hasn't been reported, and putting that all together so we can have as efficient as possible a meeting afterward.
Michael, what will you remember most about this year?
Definitely the number of transplants. But no, more specifically, it's a year of awesome training. The clinical exposure is unparalleled, and it's all done in a really collegial environment. I really felt appreciated. I felt I created some lifelong relationships here, and I'm sad to be gone, but I'm glad I was here for the year I was. So it was a special year of training.
I hope you'll realize this is a fantastic training program here. We have wonderful, dynamic faculty who are all really committed to teaching. You'll see plenty of donor hearts, you'll see plenty of complications, and in fact, you'll quickly become expert faster than you could anywhere else. It's truly a marvelous experience there. If you come to our training program, you will see heart transplants as it was always meant to be. We will learn together at the bedside, seeing amazing cases of patients who may not even have been seen by cardiologists before. We will tear apart the latest news in our journal club, and we will go together and try to answer new questions, but even more important is learning to ask the right questions that will take us out of the past and into the future together. I really hope that you are looking forward to your visit to Vanderbilt, and I'm really looking forward to meeting you.